think about it, when I learned things about work cells and work productivity and efficiency, work processes at Toyota. I was at Toyota for a decade, senior management there, and had to learn the same senior management and efficiency programs as the rest of senior management.
For the latest in health-related information and ways to save your life, check out the newsletter.
One of the things I learned there that just stuck with me was different types of work cells and efficiencies in terms of assembly lines. They had assembly lines. Doctors do not function in an assembly line for the most part. They function in work analysts, efficiency experts would call artisan or a skilled trades type of program. It's a work cell. It's one individual. And here's the best way to understand how a typical doctor works today. And we'll talk about what's wrong with that in just a few minutes in terms of fee-for-service versus fee-for-value. So fee-for-service, again, is paying a doctor to do stuff, whether it makes any difference or not. Fee-for-value is paying doctors to impact the disease levels in their population, whether these patients are even coming in to see them or not. So again, you go back to that Toyota artisan work cell model. Think about the old-fashioned blacksmith. The blacksmith is under the mighty chestnut tree, as the poem goes. He's got his bellows, he's got his anvil and workstation, his fire set up. But then he's just got junk set up around him, some nails to do in between time, a broken latch from Johnny down the street, some horseshoes that need to be repaired, some kitchen utensils from Sue's house at the other end of the street. So he's got all this work and everything is piled up, inventory, Toyota efficiency speak. You got all this inventory sitting around the machine. The machine is the artisan, the blacksmith. Again, what has this got to do with modern doctors versus the changes that are going on? Bear with me. So the artisan, the blacksmith, basically just picks up something else and starts working on it. And meanwhile, he might not notice the town water pump handle is broken behind him and nobody's telling him. Meanwhile, the whole town's going without water and he's working on nails and horseshoes. Exactly what goes on in your typical doctor's office. The doctor only looks at what's in front of him or her. The doctor's not scanning the horizon, is not organizing his work product, is not setting up an efficiency process. Artisan versus assembly line. Fee-for-service versus fee-for-value. So when we get into a fee-for-value type of project, and that's what Medicare is transitioning into, whether the doctor's going into Medicare Advantage or whether you as a patient think you're going into Medicare Advantage or not, Medicare is pushing you into fee-for-value. And let me give you an example of how that's happened. You start hearing it 20, 30 years ago, Medicare is going to go bankrupt. Medicare has had continued decline in their fee-for-service activities because it's a waste of their money and a waste of patient health. Because every time you do a procedure on a patient, you risk hurting that patient. In the environment that we have today, the vast majority of procedures are not helping, they're only hurting, as in the 90% of stents. Those of you who watch this channel know that that's the case. 90% of stents don't help patients. Well, sticking a stent in somebody's artery of their heart does. It's now minimal risk because so many have been done, but it's obviously risk compared to not doing that. The biggest risk, I will say, is the refocus on plumbing and allowing the patient to forget about lifestyle. So let's get back to the blacksmiths under the mighty chestnut tree. So that blacksmith has done the town a disservice because they've been waiting for 2 days to get water and he's sitting there working on nails and horseshoes. That is analogous to what's going on in medicine today. Medicare has noticed that in terms of what's going on in medicine today, and they are reconfiguring what they're doing. They're paying less and less. In fact, Medicare pays like 30% less for your typical fee-for-service activity than they paid even 20, 30 years ago. So you'll hear doctors complain, oh, I'm not taking Medicare anymore. You hear it all the time. And Medicare's gotten cheap, Medicare's no good, et cetera, et cetera, et cetera. Well, meanwhile, Medicare has continued to pay better and better if you do fee-for-value. And most fee-for-value has come out of Medicare Advantage. It's gotten this bad rep in terms of Medicare Advantage is for poor people. Not so much anymore. In fact, I'm on Medicare Advantage. And it's not just an issue of he that lives by the sword shall die by the sword. I'm on a very good Medicare Advantage program now. Most Medicare Advantage programs in the past were difficult for people like me who traveled from state to to state, South Carolina, Alabama, Kentucky. Not so much anymore. They actually currently now have really good Medicare PPO plans, which are good for people like me that are traveling a lot. Let me go back to describing the old smithy under the tree. So the old smithy is like the doctor. He's done the town a disservice while he was doing a very good job. In his mind, the smithy was really good. He made the best nails, the best horseshoes, and actually he could do the best repairs on kitchen utensils and the town water pump. Any smith he knew. So he thought he was really good. Unfortunately, his work was just misdirected. It was at random. It was whoever happened to get in front of his face next. And that is exactly what goes on with fee-for-service medicine right now. Guess who gets in front of the doctor's face more than anybody else? It's the hospitals. And the hospitals will say, oh no, we do fee for value. We have set up programs with many fee for value payers. We have it in our reimbursement for our doctors. No, they don't. They have is 90% you refer patients to us to do stents, etc. And then less than 10% associated with actually impacting the care, the quality of the disease management, disease prevention in their population. So again, maybe I'm going on a little bit about that. We've got a healthy attendeeship today. So yes, evidently there are folks out there. Even if you're a patient, and especially if you're a patient, you ought to know what's going on in healthcare manpower for the doctors that you're looking to see.